Hey, so all welcome back to my YouTube channel. Today we will discuss a very small topic but yet very important, that is the cephalosporins classification. I will make sure that I will make this classification very easy for you. So let's begin. Basically, we have five generations of cephalosporins. Okay, so first of all, we will start with first generation of cephalosporins. It involves oral and parenteral drugs. In case of oral drugs, it involves flexin and cefadroxil, and in the case of parenteral, it involves cefazolin. I think it will be difficult for all of us, even me, to remember this. So I will make little bit easy for you that how you can remember it. Like in the first generation, you have to remember in the oral, in word is also seen, and in the case of parental drug, in word is also seen. And in the case of oral drug, in the second, it is some bit different, but you can remember it. Now we will begin with the second generation. Second generation also involves oral and parenteral drugs. Oral drug involves, wait 1 second, oral drug also involves wait for a minute, sorry for the disturbance. Oral drug involves cefaclor and cefoxyl acetyl, and parenteral drug involves cefotetin, cefmetazole, and cefpiroxim. It is also cefpiroxim, but in the case of oral, it is cefpiroxim acetyl, while in the case of parenteral, it is only cefpiroxim. You can also remember the second generation with the word chlor here, and parental you can remember with meta and teta and meta. Okay, now we will begin with third generation drugs. It also involves oral and parenteral. In oral drugs, it involves cefixim, cefpodoxim, cefibutyl, and ceftidiner. You can call it any way you want to like. Then it involves cefixim, cefpodoxim, cefibutane, and ceftidiner. I also believe that it is very difficult to remember, so you can remember with the mnemonic that it involves zim. Okay, it also involves zim, butane, and this Mr. and Mrs. Zim went to Bhutan for dinner. So you can remember this easily. Like it involves Mr. and Mr. Zim two times. You can remember butane with the Bhutan and diner with the dinner. Okay, Mr. and Mr. Zim went to Bhutan for dinner. Then we will study about the parental. It involves ceftexim, cephalosporin, ceftriaxone, ceftazidime, and cefperazone. Okay, it involves the word tax, zox, triax, zid, and para. You can remember it by tax, zox, triax, zid, and para. If you remember only these words, it will be easy to you to remember the whole of the drugs involved in the parental one. This is for the parental and this is for oral. Okay, now we will begin with fourth generation. Fourth generation involves cefepime and cefpirone. You can also remember this with the word P. Okay, and now we will begin with our fifth generation. It involves ceftaroline and ceftabiprole. It is also very simple with the word roll in it. Okay, so you have to remember fourth generation involving the word pie and fifth generation with the word roll. Like we begin with it again. We will study the cephalosporin classification again. So in the first generation we have the two drugs. Firstly it is the oral and secondly it is a parental drug. In the oral we have cephalexin and cefadroxil, and in the case of parental we have the cefazolin. Remember it the word in. Okay, in the second generation we have also the two drugs, that is the oral and the parental. In the oral we have cefaclor and cefperoxim acetyl, and in the case of parental it is only cefperoxim, not involving the word acetyl. It involves the cefotetin and cefametazole. So you can remember with the word teta and meta. Here you have to remember this. It is very easy, I think, so you can remember it very easily. In the third generation it involves the oral and the parental drugs. In the oral you can remember with the mnemonic Mr. and Mrs. Zim went to Bhutan for dinner. It involves cefixim, cefpedoxim, cefibutim, and cefti dinner. Okay, and in the case of parental you can remember tax, zox, triax, zid, and para. What are the drugs involving? That is ceftaxime, ceftozoxime, ceftotriaxone, ceftazidime, and cefaperazone. And in the case of fourth generation you can remember with the word pi involving cefepime and cefepirone. While in the case of fifth generation you should remember the word roll, ceftaroline and ceftabiprole. Okay, I think it will be easy for you to remember the way I have taught you here. Okay, learn the important words and the mnemonic which I have taught in this video. This is very important classification. Okay, it comes even for the 5 marks or either for 15 marks as a long note involving the various other drugs. So you have to remember this cephalosporin classification very importantly, or the examiner can ask you this classification even in viva. So remember it very carefully. Okay, so thank you for watching. If you do like my channel, please share it, subscribe it with your friends, and press the bell icon. Thank you for watching.